We are agents of change, shining the light on corruption, land scams, children being raped, growing violence, and the wrecking ball of poverty. While we have grown and been able to expose many of the dark corners of our islands because of the confidence you and our advertisers have placed in us, there still is so much more to do, so much more to clean. Kandit's flame must grow brighter. Fuel this fire. If you want the light shined on corruption in our governments, rape and violence against children and women, land scams and poverty, then advertise with us or sponsor our programming in Guam and the CNMI. Call us at 671-922-NEWS or email us at advertise@candidnews.com. This is the future. Fuel this fire.
Day. I'm the owner of Guam's largest tourist attraction group. The pandemic's been very tough for all of us, and particularly for my team members. So I'm really appreciative and grateful for the PUA assistance to our team members, and more recently, the SVOG federal grant that allowed us to reopen these facilities and re-employ everyone at a critical time when PUA ended. From myself and my team, on behalf of all of us, thank you for the federal funds that allowed us to reopen.
The federal fund you provide saved many jobs. Thank you so much.
We employ about 35 technicians for our shows. Thank you for the federal funds that kept us going.
Thank you for helping with the federal funds.
Thank you for the federal funds.
Thank you for helping to save our jobs.
Thank you for the federal funds.
This ad was paid for with official funds from the Office of Congressman Michael F.Q. San Nicolas.
Buenas Micronesia and good evening, Guam. I'm Troy Torres. You're live with us here on the 7th floor of the DNA building in Hagåtña, Guam at Kandit Studios, and with us are representatives from the Republican Party of Guam and the Democratic Party of Guam, both in studio and live via Zoom. We have with us from the Republican Party of Guam, Shelly Gibson, the National Committee Woman for the Republican Party of Guam. Good evening, Shelly.
Hi, cousin.
Hi. We're actually going to dispense with my biases in just a minute, including the fact that you're my prima. And from the Democratic Party, or representing the Democratic Party of Guam tonight, live with us is Dr. Nathaniel Berg, who is the chairman of the Governor's Physicians Advisory Group. Good evening, Dr. Berg.
Troy, good evening.
Good evening. And also live with us on Zoom are members of the Democratic, or people who the Democratic Party and the Republican Party of Guam have asked to join in the discussion to complement what our two guests, live guests in the studio, have to bring to the table. And they are Chirag Bhojwani, the Executive Director of the Democratic Party of Guam. Welcome, Chirag. Hafaday. Logan Rages, who is the social media czar for Governor Lulian Guerrero.
Troy, thank you for having me.
And Ginari from the Guam Freedom Coalition, also asked to be here by the Republican Party of Guam. Good evening, Ginari. Do we call you Mr. G? Do I have that correct? Oh, I think there might be a volume issue, Ginari.
Mute.
You might be on mute.
G for short.
G for short, got it. Well, all right. Thank you, everybody, for joining us tonight. This came about because I think it was last Tuesday. Former Governor Felix Camacho, let me dial this back. For the past nearly 2 years, Guam has been in a state of public health emergency due to the pandemic. And that public health emergency was called by Governor Lulian Guerrero, who is a Democrat and is running for re-election in this year's election. And she has continued that state of public health emergency and has instituted policies throughout the pandemic as the leader of this island, a person with whom enormous powers have been vested by the laws of Guam to protect us during this public health emergency. Now, for Kandit, this was not a political thing. And as a matter of fact, out of all the news stations, we hardly covered pandemic news. But it did become a political thing, at least something that warranted further discussion when former Governor Felix Camacho joined the race for governor last week, Tuesday. And in explaining why he was running, he talked about the differences that he had with the administration's policies on the pandemic. And so it made the pandemic for us the most relevant issue in the race for governor today. And so we asked the parties to send representatives, and so they did. Before we get to asking you guys questions, I just want to, rules of engagement. And I don't think this is going to be an issue whatsoever, because before us are two professionals who are very civil, very charming people who are smart and can carry their own. And they're going to have a discussion with Kandit and with each other about questions that we have provided in advance to both parties, to be fair. But I also want to express my biases, though I don't think this is going to be an issue. I'm only a moderator. I'm not participating in the discussion. But I just want to put it out there, all right? So Shelly is my cousin. She's my second cousin. One of Dr. Berg's employees, my very good friend. I am the former secretary of the Republican Party. I am now a registered Democrat. I am vaccinated. I have disagreed with some of Governor Lulian Guerrero's policies. I don't know the science behind many things during this pandemic, and I actually didn't care. After I engaged with my own doctor and I asked my doctor what I should do, my doctor said get vaccinated. I just followed what my doctor said. It was just as simple as that for me. And so with all of that said, all of that in mind, let's start. And we did tell you guys that we were going to start with one question specifically for the Republican rep and one question specifically for the Democrat rep. You each can answer yes or no and not qualify your answers, or you can provide full qualifications for your answers. It's up to you how you want to answer these questions. But the first is for Ms. Gibson. Will you admit that the governor's pandemic policies have saved lives?
Troy, thanks. Just personal observation. I don't think we can really tell. You know, if you line up how many people die in a course of a year, yes, we can determine that there were individuals who severely got sick at the onset. But unless we really see side by side an examination, I don't think we can really tell. But to be fair, how do we know? Really, that's really what it comes down to. When you have people presenting, and you know, I'm going to defer either to Mr. G or to Doc to help me out on this question. I'm not a medical professional. I didn't work at the ER. I don't work in clinics. So my experience was purely observation. So I'm just going to say, we really can't tell. We don't know the numbers. We don't know the metrics by what they were determined.
Okay, and Dr. Berg? Will you admit that the pandemic policies have harmed the economy and in particular people's livelihoods?
Well, I'd say it's certainly people's livelihoods and the economy have taken a beating during the pandemic, but I think it's the pandemic that caused this, that the policies that have been put in place by and large have rather protected it from being worse. But it's the pandemic that did it, not the government's policies per se, as I said. So I think that you have to look at it, it's all relative. If nothing had been done, it would have been a whole lot worse. So I think many of the policies have in fact protected the island from being in a terrible shape.
Now that both of you have expressed your opinions about largely what the other side has been about and the conversations that each party has been having about this, let's go into questions where I want both of you to answer and even engage in conversation. And the first is, in hindsight, should the health mandates, such as for mask wearing and vaccinations, been implemented? Ms. Gibson, let's start with you.
So I'm gonna defer to the warp speed of President Trump's vaccine development. You know, he was very aggressive. He was hyper aggressive in pursuing the vaccines. From however many, I guess it was 3 initially, and then it expanded, and then his immediate response to get those things produced and get them out. I do believe, and our party believes that it's a fundamental personal choice. My choice to be vaccinated was based on my personal comorbidities and my own interaction as an employee, as a mother, as a sister, a friend, whatever. My personal responsibility meant my social responsibility. And then regarding the mask wearing, it's a matter of complying. For some people, complying is a nuisance. For some people, complying is, mandatory. Could I say that, it was life-saving? Again, I'm not a medical professional, and I defer to what my doctors in California, Florida, and Guam, if I see them wearing it, I'm going to wear it too.
Okay, so, all right, Dr. Berg?
Well, I think, fortunately, I would say, so Trey, you said that we're having a conversation, and I think this, in many ways, is what Guam is about. I think that most of us in this community are really about listening to other people, respecting their opinion, and respecting them as a person, even if they disagree with the opinions. And here with this idea that people are allowed to, that it's a free country, and if you don't want to get vaccinated, that's okay. From the beginning, I think, even though we've had mandates as to where they need to be done, for example, in healthcare environments, I think on a personal basis, and I think I speak for the majority of people that have been involved in this, the mandates were there to allow for protection in certain environments, but I never wanted to be part of, and I think most people didn't, a division, an us versus them, the unvaccinated are somehow bad people, any more so than smokers, right? That I don't care less for patients or relatives of mine who choose to smoke, even though I say that's not a good decision. I don't want them smoking around my kids. So if I thought at the time that we thought that COVID would spread from unvaccinated more so than, and that was true, it seems, early on. So you had to have these mandates that we thought would help to decrease the spread, and that those who were more vulnerable could get exposed. But I mean, I think mostly I'd say it's good to hear that there's no us versus them component to it. It was at the time, and there was no playbook that was out there that we opened up. I will say we're developing a playbook so that next time it comes around, we say, well, nobody was prepared, but let's be prepared if this happens again. But that's my thought is it's easy to Monday morning quarterback this. None of the decisions that we made were knee-jerk decisions, so that restrictions and mandates that were put in place, most of which involved the support of the Physicians Advisory Group, those were put in place because we thought that would help decrease the spread. It was not a control issue. So people thought that we were trying to control things. It was meant to help people based on the knowledge that we had at the time, right? So, but I think it's extremely important to know that we've never wanted to have an us versus them thing, just a protection thing when we thought that was the right thing to do.
Is there more of this conversation that you want to have with each other? And
yeah, I think
a little bit. I think that going back to the personal responsibility of it. Republicans typically believe in making their own decisions based on knowledge. We are not a party of sheep. So I hate to say it like that, but we question and we challenge and we ask questions. We share observations. We share information. When this initially started, I know I was getting 20, 30 different WhatsApps and different text messages from here and abroad, what was happening in California where I have family, what was happening in North Carolina where I had family, friends in the Philippines. I had just come from the Philippines that March when it happened. I don't think that the approach was incorrect. I think it was a little bit heavy-handed, if nothing else. I think that there was an educational component of this that was lacking, and I believe that if you don't fully, find out what you need to find out, you're going to come from a place of fear, and that's the thing that really, kind of stuck to me is I didn't want to be afraid. I wanted to have as much information as I possibly could. And so, gratefully we have the internet. Gratefully we have cooperative and knowledgeable physicians. But it was unusual because sometimes there was bickering,
Yeah, well, true. I think there, and we can engage in conversation here, is I think that we found very early on that a lot of people were living in echo chambers, a term that I've seen popularized now in the media, saying
What does that
that
mean?
what it means is that when you go on to Facebook or you go onto YouTube, the things that you click
Oh, I see.
that show that you're a conservative thinking person,
It'll
they
keep on
want you
going.
to
That's
stay
what follows
there.
you.
So it just keeps following you, and you don't get to hear other people.
Understood.
And so, that doesn't work in a situation like this, because as you're doing is what I think the people on the Physicians Advisory Group were doing, which is to try and look everywhere, right? We were looking at what's going on in Europe, as you're saying, what's going on in the different states. Is Florida's policy endangering people? Is there something different about being in a tropical environment versus a more closed environment? Parts of Northern Europe versus Southern Europe, so that we weren't sitting there trying to say, this is our opinion and we're going to stick with it. It was a constant change, and there were lots of strong opinions that were changed.
Strong opinions, yes.
Even in the Physicians Advisory Group. And indeed, we tried to say, okay, if we close the doors and everybody is allowed to speak their opinion without being criticized outside, and we would come to some consensus. And the consensus, as often as I was on when there were disagreements, I was on the side that we took a vote, and this is the opinion that we're going to give to the governor as the Physicians Advisory Group. I was on the other side sometimes. So I think it's important to know that the heavy-handed stuff, and I'll give you an example, the roadblocks, which everybody hated, right? So let me talk about that, because, and I think it's also important, Troy, that I let people know that I was asked by the Democratic Party to come and talk about the pandemic program, because I've been on the Physicians Advisory Group from day one, and so I've been involved. So they said, go there. But I'm not per se a Democratic Party spokesperson. I'm representing the administration's behavior and choices during the pandemic. So the roadblocks, right? I hated them, everybody hated them. But they were not done in a vacuum. We sat and said, what can we do? And I have to remind you that when those took place, with hindsight, we can say those are crazy exaggerated numbers. But we were looking at 10,000 people dying on Guam, and we thought that we were looking at getting containers to hold bodies. That had happened in Italy and Spain. It wasn't imaginary. It was happening in Italy. We kind of all remember all the pictures of you have to think back. There were pictures of caskets in warehouses, and they were running out of caskets in Spain and Italy. So we were a little afraid that was going to happen here, and thought, okay, what can we do, and what has worked? And in some places, they had completely shut down. And the objective was not to go full bore and shut down. We debated, how do we do this? And if we're going to do that, we don't have any science that shows it works, but if we try it, how do we measure it? Okay, so and people may not know that this was happening in the background. We worked with Apple and asked Apple, hey, for iPhones, a large percentage of Guam has iPhones. Can you anonymize data but show us movement on the island? So first, see if the roadblocks actually stop movement. And then we would then look at the data as it came out. How many positives were there? How many people were in the hospital and the like? So that was anonymized data that just showed movement on Guam. And so it showed that, yep, it had a significant slowdown in traffic on Guam. And it was used as an opportunity to educate, so that people kind of have mocked that we would have roadblocks where the only thing we would do if you're driving would get a pamphlet that would tell you more about COVID. But that was not a silly thing. That was a planned thing. Said, okay, so if people are out, at least we can one-on-one hand people that they can bring home and share with people at home to get what we felt was objective data on COVID. The roadblocks were not associated with a decrease in the number of people who were turning positive, because it turns out it was mostly happening at home. It wasn't decreasing the number of people who were getting admitted to the hospital or dying, so we stopped them. But it wasn't done arbitrarily. It was, we didn't have that playbook, as I said. We looked at things, how can we
Doc,
do it?
You know, that being said, none of that was articulated properly.
You know,
and
actually,
I think
fair enough.
Because it almost sounds like, in hindsight, you guys are saying the same thing.
Sure.
And it almost sounds like this may have just been an issue of better communication was needed.
I can't disagree with that. And I have, since I became chair and had a little bit more of an opportunity to control I'm not really one to be well controlled, if you will. And
that's why they put us together.
Yeah, but so when I came, and I've never had to ask permission to say anything. I'm the head of the Physicians Advisory Group, and I will express the opinion of the group that I think that you're right, that some of that had to be corrected so that people could come out and let people know that the us versus them thing, I think you're right. I think the decisions were good and well thought out and reversed when they didn't work. But guilty as charged as being a member of the Physicians Advisory Group that we didn't let people know that this stuff was happening in the background, right?
Let's talk about one of those things, the possible reversal of a decision. The governor only recently lifted the vaccination mandate for public places. Do you feel the mask mandate should end as well? We'll start with you, Dr. Berg.
Okay, so two different things. They're not apples and oranges. They're different varieties of apples, right? But the reason that the restaurants, as much as I hated it because I love Guam's food scene, right? But the reason that restaurants were kind of the focus in keeping people vaccinated when we thought that the vaccination was a component of spread, that was something that there was actually science behind, right? That we had science that said that is one place where it does spread. So restaurants are something that you need to control and try to limit spread. That being said, for the mask mandates, I'll tell you right now, here's an opportunity indeed to perhaps spread the word, because you're right, we're doing this, but people don't know it. So the CDC, if you go to the CDC's website, they do not include Guam. It was actually, I always, Guam is my home, it's been my home basically my entire adult life, right? So I said, okay, let's see how they put Guam. There's red, green, yellow, and gray, which is not applicable. Guam and American Samoa, we're not applicable. Okay. So I complained to our local CDC rep and said, I think we are applicable, would you mind getting the data? But we don't have it. So over the weekend and today, in fact, an hour and a half ago, we gathered the data from the hospital, looked at how did they make these decisions. They put in yellow, green, and red, and yellow and green the mask mandates are to be removed. And so we looked at it and said, okay, get the data from the hospital, because hospital admissions is one part of it, and collect the data for the number of positives. So it's going on right now so that we're being proactive in that decision-making process. The mask mandates will end as soon as it seems that we're in a safe position. The real issue that is always overwhelming to everything else, and Mike Cruz, there's Colonel Cruz or Dr. Cruz, both, who's hammered this many, many times if people are going off track, is the hospitals. We don't have, Southern Guam County or, the next, we can't send people to Saipan if the hospitals get overwhelmed. If the intensive care units are full, we're in trouble. And we've been in trouble. And the resources of getting people out here fast is much more difficult now than it was before, where we could simply call and ask for the military to send people. Now that's just simply not available. So cautiously, it will be done. Guaranteed it will be done. Fingers crossed, numbers stay the way they are, a couple weeks we'll be done with the masks. Right? That's when I've spoken to people from public health today, I said, you guys all agree we're looking at like a couple weeks and we should be there. Yep. The thing in Guam is always to protect the hospitals. And so rather than doing like some countries have done, where they've removed all the mandates all at once, we're saying remove one, see that it has no impact. Remove another, make sure there's no bump in the number of people in the ICU and in the intensive and in getting them into the hospital. Do each one, wait a little bit, and then as long as nothing's happening, we should be done shortly. There's no one on Guam who I don't think, wants to continue to have
Well,
these
I think to
mandates.
sorry, Doc.
Go ahead.
But I think to a certain extent, there's always going to be members in our community who will still wear them. You know, culturally, yeah, it's personal choice. But I think too, I have always admired the Japanese who they might have a little sniffle and they'll put the mask on immediately. You know, I've been on many, many flights, and there'll be somebody, you know, next to me or across who's still wearing the mask. And I think to myself, geez, how sick could you be? But then that is just the graciousness of their culture.
That's correct. Is that it's the Japanese culture, that component to it, and I can't say I'm an expert in that arena, but I have two brothers who are married to Japanese women, not Japanese American women, Japanese women, and they said, no, the masks are so that you don't get other people sick. So that concept
there we go.
of
Personal responsibility,
people, right?
Social responsibility.
Yeah.
Well, Shelly, what do you think of what Dr. Berg just said, that we're looking at perhaps in the next
I'm
couple
elated.
weeks?
I'm elated. I've made so many trips to the gas station and got right at the threshold. Oh man, and turn around and go back and get it. Today I went to the funeral. I got all the way to the church door, and I thought, oh man, it's not a condition that I want to continue on, but I have complied, you know, for friends and family members, work colleagues, you know, different places that I go, you know, to do my business. I want to show them that respect.
Well, I'll just say that growing up, I was just taught that when I'm sick, I just don't go around to places.
You don't go out, yeah.
Common cold or what?
Yeah.
Except if it was the chicken pox.
I'll tell you, so I was very fortunate. So in that I was traveling last summer and had to stop over in Holland, and at that time they had no mandates, right? They redid them, but I was in an ice cream store, and I'm waiting in line, and somebody bumped me, and I kind of freaked out because strangers have not bumped me in the last 2 years. Nobody gets that close. So I think it'll take a short bit, not long, but to get back to what's normal. Getting bumped in a supermarket or in a restaurant is normal. Now everybody gives people such big space.
I have a laser, Doc, that gives you the 6 feet.
Oh, gee.
And you know, I'm standing in line, and that laser, I'm like, hey. You know, it's a novelty.
Yeah.
But
so it's not long, and we'll be back to normal. I think the community has at least found that if we work together, don't have an us versus them thing, we can tolerate the restrictions on our personal behavior and personal likes and wants, so that we protect the ability of the island to care for itself, rather than having people be dead and we not having physicians be able to take care of people. There were some horrific stories that influenced us, maybe a little more than because they're isolated than you might expect, but there were stories relatively early on of so many people in the emergency rooms that there's a child who's waiting just with standard appendicitis, and his appendix ruptures while he's waiting to be able to get in and be seen in the ER. And we didn't want that to happen, right? So that these restrictions and keeping them in place longer on Guam, I think is understandable, right? Again, I think, Troy, you hit upon something, and you too, Shelly, that a lot probably was just failure to communicate and to let people know that these ideas were well thought out and that we were trying to see, right? It wouldn't have hurt to say we're doing the roadblocks to see if it would have an impact, rather than saying we're doing it to stop everybody. So there, like I said, guilty as charged, because being part of the Physicians Advisory Group, I could have taken it upon myself to let people know that that's why we were doing things.
Well, you know, Doc, on those roadblocks, we just went the other way.
Yeah, I mean, I will tell you that Apple showed that there weren't.
Yeah, we just went the other way.
It wasn't meant to monitor people; it's just to look for traffic. But we saw it wasn't completely shut down.
I want to get to the next question, which is well, where do you draw the line between preserving personal freedoms and preventing death? For example, is there an acceptable level of death to warrant ending of all public health restrictions? Shelly, we'll start with you.
You know, Troy, I don't think there's any. I'm not a ends to a means kind of person. I don't believe that even one person is acceptable. Um,
So how do you balance that?
we were smacked. We didn't know this thing was out there. We weren't prepared for it. I lost friends. I lost family. I had friends that were hospitalized for, an unbelievable amount of time, and I really have to give great compliments to the care that they got at specifically GMH, our hometown hospital. I can't say that. I think for me it comes down to the indefinite. We didn't know, and we were, every time that the news would come on, or every time that you would get an alert on your phone, I used to look at those JICs, the daily report, and just take a deep breath and pray to Santa Maria, because as the numbers were increasing, it was frightening. And I think that it would have been, Doc maybe should have been there before, to give a bit of comfort and security and, the direction that really was happening. We pray for all the, pray for those who died, and we pray for the healthcare workers and the frontliners that really presented themselves at their best. But I don't think that, do you have 100? Do you have, we were up over 300 now.
I believe it's 328
right?
As of tonight.
So
328.
Then you look at the numbers in New York. You look at those 15,000, seniors that got sent back, knowing that, they were susceptible, and they contracted, and then they passed. So I think that what I would have liked, what I think would have been a lot better received was a sense of trust. And that just wasn't happening for whatever reason.
It's a tough one, and I think, so in fairness in your conversation where you're saying on that side that you in essence, you can't put a value on an individual life. But I would also, so in fairness, I'll sort of take the other opinion, which is neither Democratic nor Republican, it's just conversation, but you can be too careful. And I remember a conversation with, I'll just say someone in the school system, because that's I remember what the conversation was. And somebody said, we were talking about putting plexiglass up and all these other things, and they said, you can't be too careful. And I said, actually, you can. You can. If you want to make the speed limit 5 miles per hour, nobody's going to die in a car crash. But that's too careful. You have to take everything into consideration, so that, you can be too careful. You can be too restrictive, like I think Hong Kong, for example, has been too restrictive, and not looking at what is a reasonable restriction on coming in and quarantines and all those things. And that balance is extraordinarily tough. And it's a bit made more difficult when you don't have as much science. We try to be scientists, but it's tough when there's no data out there. How long? I remember we had the CDC reps saying, okay, the 80% of it will happen within the first, I'm actually making these statistics up, but it was something like this. 80% will happen, the transmission will happen within the first 5 days. So you can let people go up to 5 days. And people are saying, well, then let people go up to 5 days. Oh, but you still have 10% more if you don't go out to 14 days. You're saying, okay, so that small extra amount, do we have to keep people locked up for an extra 10 days? And as the science went on, we found that you could shorten it, and that it wouldn't have a significant impact on the community. Concern was raised that you would seed, that one person would go to a multi-generational family and get people sick. At that time, when we didn't know everything about, well, we still don't, but we didn't know a lot about the transmission. So turns out we were probably a little too careful in sheer numbers, but that's hindsight. We didn't want people to die, and we were really concerned about the elderly. The beautiful thing about Guam was that so many people got vaccinated so early that I think those numbers easily could have been doubled or tripled if we hadn't had protection. People still got sick, but they didn't die, was the critical thing.
I'd like to make the observation that what the two of you are saying are a little different from what the leaders of your party have been saying for the past couple of years. Dr. Berg, in your case, you're taking a more conciliatory tone than Governor Lulian Guerrero has taken over the past, or many times over the past couple of years. Shelly, you're taking a tone that is a lot more conciliatory than former Governor Felix Camacho and some Republicans in the legislature have taken. Are you both willing to admit that your party's leaders could have done a better job communicating things?
You first.
You
first, Doc.
What's the thing? I'd like to call a friend.
You'd like to call a friend? All right. And is it Chirag
would be able
or is it Logan?
Either one. Logan, perhaps as
Logan, you want to take this, Logan, from the governor's office?
Okay. Can you just repeat the question for me? Could our leaders have done a better job?
Could the Democratic leaders have done a better job communicating what Dr. Berg has just communicated? Because it seems that over the past couple of years, for the majority of the time, Governor Lulian Guerrero's communication of her policies have been a lot more strict than what Dr. Berg has just put out.
Okay, so, sorry, I didn't really get to hear Dr. Berg's answer. I couldn't hear him. But in terms of could things have been better?
Communicated, better communicated.
Better communication. Yes, definitely. As the virus evolved, as we saw new variants, it was moving very quickly, and we had to adjust very quickly. So were communications mistakes made? Yes, I will admit that. But remember that this pandemic was unprecedented. Like Dr. Berg said earlier, there's no playbook, and one of the biggest hurdles that we had to deal with that we've never dealt with in the history of our country, in our lifetime, is that we live in an age of information, but we also live in an age of disinformation. So while we were all actively trying to fight this pandemic and get good information out there, we were fighting disinformation and misinformation. So were mistakes made? Yes. Could we have done better? We were doing the best we can. And we're fighting at the front lines, relying on the experts, getting feedback from everybody, trying to get as much feedback as possible. And we weren't deaf. We weren't deaf to what people were telling us. We just had to preserve life. And that was our main focus, preserving life.
Thank you, Logan. Shelly, do you want to?
That's a fair statement coming from the governor's office. And, I will also disclose that Crystal's like a daughter to me. But I think that when you're developing message, Doc, has portrayed, a very different perspective. And I think that, something like this, I go back to this education piece. There was, maybe there, hindsight is 20/20, they say, right? And I'm fond of saying we can autopsy it to death. But I think looking back and then conversely looking forward, how do we avoid those missteps, in the future? Because we know something else is going to happen. But the fear that prevailed and the resentment, and the frustration of the community could have been easily circumvented. It could have been circumvented. I can't say how much ease or how much difficulty. But, when you have a population who has access to all kinds of technology, and, the phones you're on the phone talking to family members, in the States, and they're telling you, well, we don't do that here. And I've traveled 6 or 8 times already. Every one of the meetings that I attend in the States, they're all mask free. They're mask optional. And then I come home, and before I get off the, I've got a mask on, and I got to wear the mask until I get in the car and get home. So, I would just strongly encourage, tell us.
I can't disagree with the communication part. I will tell you that. So, in traveling during the pandemic, I have had everything from walking on planes and seeing people kind of take their masks off and nobody paying any attention to it, up to I took one of the Middle Eastern airlines. It's the only way I could get to Europe. was the people wearing, and I have to go for family reasons. It's not like I've been on lots of vacations. I haven't been on a vacation, but you had to wear face masks and a mask the entire flight, whereas others were late to make it be responsible. We were talking before about testing. There's one time I had to get tested 5 times in 24 hours just to get home. Really crazy. So, and other places don't do it. So I think in our culture on Guam is a huge mix, right? So we have the influence of the Japanese, who are extremely conservative when it comes to healthcare, like we've talked about. The Koreans essentially
Pretty
equally,
close behind.
versus others who are more lackadaisical about it and say, sort of it's something where people don't pay as much attention to their health or to the health of others. So in that community, let me say, there are 2 things about this. One is, I think the communication is correct. Definitely. That is the big thing for me sitting here now in this conversation is how would we have corrected things? And I'm, like you said, looking back, but we should look back and say, what did we do wrong? One thing that could have been done better was outreach directly into the communities who didn't have access to the education for language, education levels, and other cultural factors that were playing a role. For example, what we discovered was that many people who have died on arrival have such a strong cultural fear of dying alone that the hospitals had to, and did when they discovered this, make an enormous effort to say you won't die alone. Come to the hospitals and we'll find a way so the family member can be with you. Even if it means they get dressed up in their suit, they get in their room, and then they can take a mask. But they walk through into the ICU so that people would not die alone. And I get that, right? But that was a message that's hard to get out. And I mentioned that echo chamber, that people didn't want to listen if they disagreed, to listen to the other side, but also the difficulty in overcoming that fear that people have had. And you look at the polls and talk about releasing mandates, and I get WhatsApps from 5 million people just like everybody else. There's a great deal of fear of loosening anything here because people are still afraid to die of COVID. And this may sound come as a big surprise to your audience and maybe to you yourself, but we have people. Just today a scheduler came to me and said, this guy that you need to get in for the lung biopsy treatment, we think he has lung cancer. We've told him we're afraid you have lung cancer. He doesn't want to come into the clinic because he's afraid that he might get COVID. Yeah. So he's more afraid of COVID than which he might get versus the lung cancer which he has, right? So that fear has been definitely a hard obstacle to overcome. It wasn't that there was an intentional wanting to put in fear. It was intentional of wanting people to realize this is a dangerous virus.
I think
less so now.
I think that word intentional, I don't believe that there was any intent.
Yeah.
I don't believe that it was intentionally frightening. But I think that in crafting the message, they might have forgotten about that.
Again, playbook issue, yes. But how to get that message out when we wanted to make sure that the message got out that this is a very serious and dangerous thing, and then it can become sort of difficult to pull that back and say, okay, we're doing better now, it's okay. That's very difficult to do, and I think there'll be books written on how, Burbank, California did a better job than St. Louis, Missouri, and this is why the people were appropriately afraid of COVID, but not over afraid such that they wouldn't go to work or wouldn't go to the doctor. There's a huge, from a doctor's standpoint, I can tell you that the last 2 years, so many more women are dying of breast cancer because they're afraid to go get a mammogram. Right?
I think the two parties are almost saying the same. This is an amazing conversation. You're almost saying the same thing. We're going to move on to the next question. Thousands of Guamanians are no longer gainfully employed, in some cases going on 2 years now. What message do you have for those who wish to get back to work? And who did we start off with the last time?
Me.
I can't remember now. Okay, so Shelly, we'll start with you.
I'm a very strong advocate for education. I have an educator in my house. I would strongly and vigorously encourage him, take whatever time that you have to build your skills. We have great programs that Trades Academy, GCC. I know that the federal funding for education is, so ripe for the picking, and build your skill sets. I have this idea that I want to learn how to be a tractor driver. I still have a job, I hope. But I think that perhaps, Troy, moving forward, they don't get the same job that they had before. So you're either going to do career enhancements or career transition. And there's great counseling opportunities at the University of Guam. Online schooling is so prevalent, and you say that you're, a COVID, I don't know, what's the word, COVID affected, and you get, some passes on tuition. But as much as possible, I would always say, enhance your skill set, prepare for career transition. I think that Guam, we're such a young community, or the age demographic. You've got the 25 to 50s. 50's not too old to look for another career. I know friends of mine who, their kids are retiring. I said, your daughter's only 45, but we are such a young community, and that would be my suggestion. And actually, that's a suggestion that I've given many people.
Well, I want to follow up with that because you're here for the Republican Party.
Mm-hmm.
Is this? Let me just rephrase the question to be if Republicans get into Adelup or control the legislature. What are these? Is the funding of education or the enhancement of education programs going to be among the priorities for career placement or for the creation of
Troy,
jobs?
I struggle every day with the fact that I believe as much money as we spend on education, it's really not enough. It's not enough that our schools, and I pass by the schools and I don't see the grass mowed, and that kind of bugs me. I have a son who teaches in the public school system. I'm very proud of that. I see some of the public school kids that graduate and ascend into great careers. So for me, yes, on behalf of the party, I would say absolutely. We need to fund the education system with as much gusto as we possibly can.
Okay. Dr. Berg?
So I think we share that. I have both my brother-in-law and my sister-in-law teach on Guam, or teachers, and my son is a teacher. He's in rural Tennessee, and if anybody knows him from FD, just keep bugging him to come home. He says he wants to get some more experience before he comes home. So my hope for Guam out of this is that as people look forward to Guam's economy coming back, both with tourism and with the military buildup and being a service-based economy, is that I think that we're coming into an era now where education is going to be your key to success on Guam, versus previously there were enough jobs, you could get jobs.
Sure.
The cost of living was a little bit lower, and you can see that education is what's going to preserve Guam's success, or I shouldn't say preserve, will ensure our success in the future. And I agree with you that there are certain components. It makes me sad to see the schools not having the grass cut too. But I think there are ways of engaging even students in that there could be outreach from the Department of Education itself to say, can we adopt schools? Can you help? And the whole community gets involved with education. But from a political standpoint, I think I'll defer to
I was just going to ask
political
for
representative.
the follow-up question.
My thing is that my family is very heavily involved in education, and it's because we feel that that's the future.
I come from a family of educators.
Yeah. I'm coming from one now.
So for your follow-up question, you're going to your lifeline, and it's Chirag from the Democratic Party of Guam, I'm guessing. Chirag, the question is, as Dr. Berg was talking about how what message he has for those people who have been out of work because of the pandemic, and even for the past 2 years of the pandemic, what message do you have for them? And he agreed with Shelly that education is what's going to create jobs. Is that the Democratic Party stance? And if so, how will Governor Leon Guerrero or Congressman Mike San Nicolas and whoever would be running for the legislature ensure that that's a funding priority?
Troy, that is a good point, because in addition to the public health aspect of COVID-19, the economy and the jobs and livelihoods of our residents, that's something that's very important. And ultimately, we need to understand that COVID-19 didn't just affect Guam, but it affected the entire world. And every economy today seems to be impacted, some more than others. And so, while we hope that our source markets are ready for tourism and allow their residents to begin traveling without quarantine when they come back, that's one way that we can get people back to work. But also, we don't know what the future holds or how long it will take to reestablish our tourism industry. So, the first bill introduced of this 36th Guam legislature was a bill to waive the fees for filing of business licenses. And since that bill was introduced in 2020, DRT issued over 1,500 new business licenses. We have just this week, we passed the bill to help Guma, which is an incubator for small businesses. We've also just opened the maker space at the Chamorro Village. But also, I think, we need to take this time to reset and, whether it be learning a new job, a skill, looking for work in other industries. Hopefully we can return to normal sooner than later. It's not the governor's mandates that's keeping people out of work. It's other countries are not letting their residents travel. That's what killed our number one industry. And, one thing that I have to say that the Democrats have done, our government has invested millions of dollars in the dislocated worker program. We've had over a dozen boot camps to help retain those who are displaced by the pandemic. People are learning new skills. These boot camps are filled up. Every time there's a graduation, there's 20, 30 people graduating. They're learning new skills in medical billing, construction, ship repair, truck driving. Our construction industry is thriving, and there are jobs out there for those who want them. So workforce development, I agree with Shelly and Dr. Berg. This might be the time to learn new skills, but also take advantage of the programs that the government, the administration, the legislature has put out for us to learn these new skills.
So is it the stance of the Democratic Party, just to be clear, is it the stance of the Democratic Party that that educating a workforce is a priority, and so therefore it will receive funding priority?
It's not only the stance of the Democratic Party, but, the proof is in the pudding. We've been doing this for the last few months.
Got it. So we are going to take a break before we get to our next set of 4 questions. But before that, I know that there's been a lot of comments that have been coming through. Johnny, you want to take this?
There is lots of comments. A lot of people are upset. So I think you should filter it.
Upset which way or the other?
On both sides.
Well, Ken Leon Guerrero is the latest one I see. Government not keeping people from work, really? Just goes to show that as far as the administration is concerned, denial is a river in Egypt. Sorry, I used to go to a gay club called Denial. That's how old I am.
Jose Tepahago Jr. says, right now GDOE is looking for a waiver for the days shorted to our kids. They don't care about education.
Jose Martinez says, as long as Governor Leon Guerrero continues to declare herself sole authority each month, any messaging from the Democrats seems empty. There's a lot of comments, guys.
Plenty.
Even Logan is addressing comments.
Yes.
My favoriteest and most beautifulest cousin in the whole wide world, Mona Silva Tyron, says, the message has to be clear and the guidance also has to apply to everyone. I think this was regarding the discussion on communicating.
Can I just add something, Troy?
Yes.
I think one thing that definitely, so as I said, I'm not a spokesperson for anybody. I'm representing the government, the current government, how they've reacted. For sure, it is a complete inaccurate statement to say that with regard to the pandemic issues, that the governor has acted in some dictatorial manner, comes in with a gavel and gives you your 2 minutes of speech. It is an impressive thing to see, and maybe someone should record it for the future, the morning meetings that are done and the physician advisor groups that are done and the other groups that are done. They come in the morning, you can barely fit the number of people into a computer screen for the Zoom, who are encouraged to provide their opinion, whether they're from public health, from education, from finance, from different aspects of healthcare, from the Guard. The Guard is there in two different ways. That her opinion, she ultimately makes the decision, but it is impressive to see the group that she brought together to provide that opinion. I don't know the party affiliation of 3/4 of them because they're not. Okay, the chief of staff is there. I guess I could say I know his affiliation, but most of the others are not party administrative people. And when the physician advisory group was put together, Dr. Cruz and I don't know what anybody's party affiliation is. It's that input that for sure the governor has done extremely well, is to listen. Right? The decisions you can criticize if you want, but they're not dictatorial. They're all come about when we would make opinions. She challenges us, and her nursing background has been invaluable, and that we don't have to explain healthcare concepts to her or public health concepts because she understands them. And if she doesn't understand them, she can ask questions and get if you will, updated. But that is anybody who says that she commands things. I wouldn't serve in that capacity to be told what to do and the yes ma'am, okay, I agree. There's no yes ma'am agreeing there at all. There's bickering, not good, disagreements every single day. And she has to sort of, in the end, somebody has to make that decision. And I'm glad it's not me. Right? So that's not, I think that's an unfair characterization of whoever said that.
Shelly, do you want to respond to what
No.
Dr. Berg said? No? Okay.
No,
All right.
I have other questions, but let's go to the break and then.
Yeah, let's cut
we'll
to a break.
discuss.
When we come back from, how long is our break, Ole? We've got a couple commercials? We have about 2 minutes. So in 2 minutes, we'll be back from from paying our bills, and we'll get to the next round of questions. Thank you guys so much, and we'll be right back.
Half a day. This is Governor Lou Leon Guerrero. If you're struggling to pay rent and utilities because of the pandemic, your government can help. Our Emergency Rental Assistance Program provides direct relief to you. To date, over $6.9 million has helped over 1,500 households.
Apply online at eoa.guam.gov or call the Department of Administration's Emergency Rental Assistance Program at 671-638-4518 or 19.
We just want everyone to live a healthy lifestyle and show them how to do that, move their body, and really have friends and family that everyone connects with, keeps you on track too.
Menon makes a good point, and I want, I guess, Dr. Berg, or to maybe this is a better question. Well, Dr. Berg, you let us know what you want to do. When was the last time she held a public town hall and heard the people's voices?
I can't give you an exact date. The last one that I can recall had to do with the schools, that she attended an open forum for the schools. It was a Zoom, but that's the last time. It might have been in the late fall, November, something like that, but I can't remember the exact date.
Okay, is that something that you would recommend that the governor do a little more often?
I suppose that would never hurt, right? But Yeah, and I think as we were sort of talking in the break, it's tough when you want to get an advisory group and you want to get the opinion, but you don't want it to be uncontrolled. I think is what you could say, where you want to be able to get everybody's opinion and be able to digest it and then make a decision, as she is forced to do every day. Town halls, I mean, I think they're more effective when they're in person, because people won't be rude, right? And generally let someone else talk. They're great, but I think during the pandemic, it has been tough to do that, especially because there are some people who don't respect decorum, and won't take the time to let someone else talk.
We watch the legislature. We know
Yes,
that.
exactly. That's what I was talking about.
Did you guys watch the Commonwealth legislature today?
No, catch that
You know what?
later.
I digress.
Catch that
I
later.
digress. Dr. Berg, part of the message from the administration about the need for restrictions had to do with the lacking facilities and capacity at both hospitals, GRMC and GMH. What will your party's elected leaders commit to do to ensure we're better prepared the next time this happens?
Well, the governor is planning on building a new, larger hospital. Some things have already been done. I'm going to speak from the healthcare component of it, then you can have the politico speak. So let me tell you some of the things that have been done that have been great, and the credit goes to people at GMH and at GRMC. So we have a great shortage of intensive care physicians, and you need them 24 hours and 7 days a week. And a friend of mine was in intensive care last fall, and I was amazed to see how they've used technology. It's a life-size kind of television, or a monitor, I should say, with the intensive care unit physician at the other end. And for intensive care unit physicians, they don't necessarily have to touch the patients. These are patients who are already in intensive care, and they have highly skilled nurses and hospitalists. Those are doctors who work solely in the inpatient arena. So they now have experienced high-level intensivists 24 hours a day available in the hospital to help man it, because it was a huge fear that we were going to get burned out. You couldn't have Jolene Uggan covering 24/7 is what she was trying to do. And she's great, but she was going to get burned out, and this technology saved us. So some things are already in place. That technology is there, so that if we don't have capacity, we have it, and we're able to use that. So that's one thing that I've personally seen at GMH uses technology to an extreme. Use everything we can to not have human beings have to be here. But in terms of planning, other types of planning, public health aspects of it, we have already talked in the Physicians Advisory Group and in the Governor's Advisory Group in general about the need to build that playbook, right? And that part of that playbook is having extra capacity at the hospital and having reserve capacity. So that's on the physician side of it. But Chirag can speak on the funding aspects of it. Those, of course, don't have anything to do with me.
Chirag, Dr. Berg is throwing it to you. He just described how there are things that already are happening to expand hospital capacity, how he agrees with the plan to build a bigger, better hospital, but he throws it to you on what more the Democratic Party is advocating should be done to increase capacity so that the next time this happens, we don't have to have so many restrictions.
Well, what the governor has always stated, which was a healthy community is a healthy economy. So we want our economy to thrive. We got to make sure our community is healthy. So absolutely, we've long believed that single payer healthcare would lead to more accessibility to healthcare. So we're trying to improve access to insurance. The governor is also actively trying to build a new state-of-the-art hospital to fit the needs of our community. And thanks to this Democrat majority, we were able to finance it. There is a clear investment in health and safety of our people, but also I want to go back to, earlier there was discussion about where was the playbook. I want to, just put it out there that the playbook we were using was the playbook that was created by Governor Felix Camacho. And with the evolving, situation with COVID, if you actually look at that playbook for a pandemic like this, it required everybody be quarantined at the UOG Fieldhouse. That was supposed to be retrofitted with cots and put everybody in there. Obviously, as we learned with COVID, that would not have been a good idea. Just last week, we saw at St. Dominic's, there was an outbreak over there and people were getting COVID. So, we clearly have with the changes in the pandemic, we're finally, as soon as this pandemic's done, we hope we can use the lessons we learned to update that playbook that hasn't been touched in years. But you're right. Healthcare is something that we need to prioritize, and we're doing it with facilities. We're doing it with programs, but also maybe I'm going to throw it back to Dr. Berg to share what he shared earlier with me about how they're trying to keep on. There is in the playbook a response for any like nuclear attacks or anything where doctors respond. The doctors themselves are trying to keep that group active to ensure that any changes with the viruses, they're there to respond.
Well, before we do that, I first want to we're going to get Shelly's or Miss Gibson's comment first from the Republican Party, but I do want to add that the Guam Emergency Response Plan that you're referring to, that playbook for the pandemic, which was created during the time of former Governor Felix Camacho, Frank Blas Jr. was the Homeland Security Advisor at the time, and that UOG COTS plan was an option that the governor could use. Another option that the governor could use is the taking of facilities, private facilities, and all that's all part of the Guam Emergency Response Plan. I just wanted to interject my knowledge about what that plan says. Shelly, what's
just
the Republican response?
Just to go back, Troy, before we took the break, I did want to make a comment about the public access to those physicians advisory group meetings. I get that they needed the professionals. I get that they needed the medical input and all that. But I think that, how many boards and commissions have a student advisor, or they have a public advisor, they have a public member? And then I did want to shoot to Mr. G specifically on the construction aspects, and then, relative to this conversation.
The facility, you're talking about medical facilities.
Correct.
Mr. G, so Shelly has deferred to you about this question. Part of the message from the administration about the need for restrictions had to do with the lacking facilities and capacities at both hospitals. Am I muted? I'm so sorry. No, it says me, okay. What will your party's elected leaders commit to do to ensure we're better prepared the next time this happens?
Hello, everyone. I can't speak for the party. I'm not really in a position to do that, but from my knowledge, the hospital restrictions have been for decades and decades an issue. And so, of course, my question is, with the funds that have come in, what have we been able to do to address that? And it seems like only now we're discussing a new facility. So we're quite a bit late. We're at the end of this thing, and here we are only talking about a facility now. In the construction industry, you can erect and build facilities to address, pandemics, and be able to have a facility that can house people. But we didn't do that. I think we spent more time buying stickers, posting them on doors, posting them on floors, promoting sanitizers and temperature checks, so on and so forth, rather than addressing the real issue. The real issue is, and has been, is there are comorbidities that are taking people's lives. There's no arguing that anymore. I believe it's 90% of deaths are folks that have 3 to 4 comorbidities. So my question is, what have we done to address the real killer? And it seems like nothing. We closed gyms, we closed everybody up, and we left McDonald's open and smoke shops open, which to me sounds like we've headed the wrong way. So regarding hospitals, to answer the question, we didn't address it. We should have addressed it right away. In 2 years, we should have had a facility built already with the funding coming in. But we continue to say that we need a facility that's going to house. We don't have the facility to house all the people that will get sick. We've been saying this for, I think, decades. So
Mr. G, you would agree then that these facilities have been needed, and the construction of these facilities moving forward is something that should happen?
Of course.
Okay.
Years ago.
Okay.
Especially once the funding started to come in to address this pandemic, why didn't we start that?
Okay.
Again, so many folks I know that they received funds, whether for schools or other facilities. They had thousands, hundreds of thousands of dollars they received. I can't use their organization's names. And they said we didn't know what else to buy with it, so we just bought extra masks, which are going to end up in the ocean. Lots of sanitizer, which is just going to be stored away for decades and decades. We bought lots and lots of, plexiglass. I mean, all these things, we just went out and binge shopped rather than why didn't we use that funding for a facility, since that supposedly has been our concern. We don't want to overload our facility and faculty.
Okay, let me throw this back. So, what Ganari is saying, I don't know if you were able to hear from over here, but there is no disagreement about the need for facilities, but there is a criticism, and I'm not sure. Shelly, you tell me whether this criticism is shared by the Republican Party of Guam. There is a criticism that it should have been done faster with the amount of money that we had, and that money was squandered. Do you guys want to discuss that?
Up to you if you want.
I don't like the word squandered. I think that.
Well, that was my summary of what he said. Yeah.
I wouldn't say squandered. I think that all things considered, it was used in a manner to address the immediacy, the urgency of the issues that they were dealing with. I would have loved to have a COVID clinic. I would have loved to have COVID testing when I got in, rather than have me sequestered for 2 weeks at a hotel. But as I said, hindsight is 2020. So one of the things, and I'm sorry I didn't hear Mr. G entirely, but I do want to address the mental health facilities that I believe before pandemic, after pandemic, we've got to get a hold on our mental health and wellness facilities, expand them. We've got a huge drug problem here, and then, that needs to be addressed with hopefully the same immediacy that we addressed the pandemic. We've got a huge crime issue. We've got families, breaking apart. We've got, generations being raised by, young, kids being raised by their grandparents because they have absent parents. So I just wanted to add that.
And I think, actually, but I'll take that opportunity as long as we have the ears of the public. Those are everything you mentioned is really linked together. And the reason I say that is I think before one judges someone who's using drugs, if that person doesn't, sometimes and perhaps more often than not, the medication, the drugs are used as medication to treat mental illness that was already there. And if they had access to adequate mental health facilities, that the use of drugs would go down dramatically, and that the theft, the crime is so often associated with drug use. So it starts with mental health education, and something that has not been addressed even in public or private health care. We have gym to teach people how to keep their body in good shape. We have very little in terms of mental health education and prevention and hygiene. We do things, we say we wash your hands. We don't tell people take time to relax, talk to people, don't use the phone all the time. That sequester people away from the social interaction that contributes to the ill health. No question, we share that opinion. That's a struggle throughout the country, but and hopefully there will be more resources. It's been a real struggle to get mental health providers to come out to Guam, and I'm actually trying to do my best to help with that. But I think there's a big move in the community to say, how do we get mental health providers out here? But I think it also has to start in the school. Now we're definitely going on a tangent.
Yes.
But
sorry.
But I think part of it is that the reason we want to get the schools open as quickly as possible is so that there can be normal interaction with people, and that's been a huge issue. And the governor's been aware of that and tried to get the schools open as quickly as possible. In part because we know the dangers of online education for mental health, right? And I had to be careful how close I get to it because it's very close to everybody on Guam, right? We have the loss of a physician's son recently, and it hit very close to home. And I don't know if it's related to the pandemic. No one can ever explain these things, but the ripple effect is huge whenever that happens. And so if we have made an effort to try to get normalization, sports, And I'll tell you something that's happened that people may not be aware of. The governor made a huge effort to get sporting activities to get to come back. We had a policy that you could have 4 groups of 4 family members separated by 6 people. But the schools chose not to do that. That's not the governor that chose that. She took our advice. Some of the bigger sports organizations and that my kids participate with, we're allowed to have 2 people go and visit. That is not the government's policy. The government's policy was, and I think it was reasonably sensible, was you could bring family members. Family cohorts could stick together and be separated because the governor said we got to get sports, we got to get people out there and getting healthy. So the Mr. G criticism is fair, but it's not to land on the governor's desk or whatever you want to say. She was getting very upset by these sports organizations and the schools that wouldn't allow that to happen so that kids would be more physically active, right? So we all want people to be more physically active on Guam, right? So that's something that the community didn't seem to the need to follow our suggestion of making it possible for people to exercise. And in my mind, and I think most people understand, that sports can bring people together. It's where families come together to watch their son or daughter play. That's good. That brings families together as opposed to kids going out with other kids. So it's all good. And I would encourage the organizations, if you're listening, please pay attention to that and open up as quickly as possible to allow families to attend sporting events.
Doc, so thank you for that. Thank you both of you for bringing up 2 very different tangents to the question. We got to move on.
But it's a conversation. You said make it a conversation.
And you know what? God bless you guys for that. And that was important information about mental health and sports for sure. Thank you. But let's move on to the next question. I believe next up is Ms. Gibson. With normal local tax revenues having fallen tremendously, do you think Guam should have bitten the bullet and either laid off or furloughed employees in order to direct more federal recovery money instead to residents and businesses?
You know, Troy, it's real difficult for me to answer this. I got friends and family in the Guam system, and I would never, want to yank somebody's paycheck. That said, I have friends and family in the private sector. I work in the private sector. To some, it was unfair, to shut down the economy, but then the government employees were still being paid. I am never coming from a place of talking about somebody's paycheck. I think to that regard, I would have preferred more judicious spending of these federal funds, even the playing field, so that these businesses who provided, box lunches that we were preparing for the kids, or, special services could have been included rather than bypass the procurement process.
So essentially what G was just talking about a few minutes ago was how federal pandemic money was being spent.
Yeah.
Okay, fair enough. Dr. Berg?
Well, okay, so again, the criticism of not having the information out there, I can tell you that some of the things that happened in the background, there were certain efforts to get, for example, Department of Education employees who, rather than, and this is not a blanket thing, it's talking about pockets where people were paid to stay home and saying, wait, they can actually be helpful somewhere else. But it was impossible to force that. So there were messages in our meetings that even as of when I came on board saying, can those people who are being paid to stay home, can they not come in and do other things? Help direct traffic, not car traffic, but direct traffic at testing sites and things of that nature. But it turned out you couldn't force people to do it, right? So, and I also think one thing, Troy, I don't know who wrote the questions, but it said direct more federal money to residents. I believe that the government of Guam employees by law have to be residents. So I was saying those are our friends and neighbors and other residents of Guam too. From a political standpoint, again, I can defer to Logan as to whether or not the governor should have laid people off. But in my idea is, if in the next playbook, in the job description, it would say, in an emergency, you may be a teacher's aide. You may be a teacher's aide, but in an emergency, you're also, and give them some other task that they may cutting the lawn of the school or something. I mean, I know that sounds a bit silly, but the idea is that we can better be prepared by having people have supplemental jobs. In the military, we had different jobs. As I was a radiologist, but then it said you can also be tasked with being a general practitioner. You can also be tasked with doing triage. So you have these categories that can be done, and that may be something to look at to say for all government jobs, you can be tasked to do something else in an emergency situation. But right now, I don't think that works that way.
Let me throw it to Logan. Logan, Dr. Berg is deferring to you. The question is, with normal local tax revenues having fallen tremendously, do you think Guam should have been the bullet and either laid off or furloughed employees in order to direct more federal recovery dollars to direct aid to residents and businesses? Dr. Berg suggested that one of the things that maybe could have been done differently was a mechanism to have GovGuam employees who were at home maybe channeled to do other things, and then he deferred to you to answer this question in depth.
Okay. This actually came up before I joined the government. I joined the administration back in February of 2021. And prior to that, I had this conversation with a number of people who online felt that government employees should be furloughed at the time in 2020, that they should be furloughed because of what was happening to the private sector. So if you're asking me, should the governor have furloughed people during that time? No, absolutely not. It would be unconscionable to push people into an impoverished situation where they would have just had to rely on federal aid. And the legal consequences and ramifications of doing something like that. If the government had the money to pay them, then it would be unconscionable not to. So I think what the crux of the conversation is, with people being furloughed or with people being out of work, I guess there's a show of solidarity in furloughing people. I don't think that's responsible governance, and it would have had a catastrophic effect on not just the people who would be furloughed, but everybody. Pushing people into poverty is never, ever a good thing. It's just going to be catastrophic on crime, and just across the board. So no.
Okay, thank you, Logan.
Troy,
yes,
real quick,
go ahead,
I
Shell.
just want to say something.
Ms. Gibson, sorry.
You know, if they had been furloughed, they would have been paid by the PUA, right? And, you know, I do want to invite Mr. G. He's indicating he has a little something to say.
Okay.
But yeah, they would have been paid by PUA, just like, you know, just like the private sector was.
So one
but
thing, Ms.
again,
Gibson.
I don't, you know, I am not going to yank somebody's paycheck, but I'm saying at those moments, was that considered?
One thing Ms. Gibson points out is that if GovGuam employees had been furloughed or laid off, they would have qualified for PUA like the rest of the private sector, and she is deferred to Mr. G or Ganari to take the rest of this answer.
There have been a lot of businesses that had to shut down. I'm not sure how much help they were received. I recently spoke to a female business owner. She said when our business was shut down, we continued to pay $5,000 in our mortgage payment. No customers, no clientele. We didn't want to lose our facility. So, you know, I like what the gentleman said earlier. We don't want to do that. You know, we don't want to take income away, but it happened. So,
okay, all right.
Something to consider. You know, not for me, but for you, it's okay. That sounds kind of cruel, because there were a lot of businesses that had to shut down, continue to pay, and bankrupt, and let a lot of folks go.
Thank you. All right, Dr. Berg.
The only thing I would say with that is PUA would not have provided health insurance. So you might have had thousands upon thousands of people further restricted from access to health care. And I'm a private business person as well. So I kind of get it from both sides, but I just think that it would have been an extremely difficult situation had we had a huge number of people suddenly out of jobs with no health insurance. And also, where would you start with that? It could have been, it would have been extraordinarily difficult if you said, okay, we need to lay off, who are the non-essential employees? Somebody in the fire department, or the teachers that might be called back as things quickly got better? I don't, the parks, we have to have, things had to be clean, they had to be inviting. I don't know that we would have been easily be able to identify who is non-essential. I think but I can say the concept of suddenly having all these people without health insurance would have been a very difficult thing for me to imagine, especially all the families in the Governor of Guam.
Can I just say that I'm really happy to be in a position where I am not participating in this discussion. I love this. All right. Dr. Berg, it has been suggested that the gross receipts tax or the business privilege tax should be rolled back to the 4% that it was at before as a way to provide relief to businesses. Do you agree? And if you do, how will you address any potential budgetary shortfalls that may occur as a result of such a rollback?
That's really a political question. So I would even
who do you want to
say,
throw that to? Logan or Chirag?
I suppose if that's I don't know.
Okay,
let
you know what?
Decide.
One of you guys decide. Chirag's going to take the question.
You know, that suggestion has been made over and over again. It seems like it's a false flag, you know, and businesses won't cut 1% off your can of Coke at the store or 1% off the price of a car. This argument is just simply to try to put more money in their pockets, create more division. And, you know, thanks to the work of Senator Regine Bisco-Lee, Senator Joe Augustin this term, more than 85% of businesses are currently paying a BPT of less than 3%. And, you know, the end result, under the Camacho administration, you have to wait over a year for your tax refunds. Under Governor Calvo, the courts forced him to pay it within 6 months. On Friday, you know, it was like Christmas came early. We heard that people who filed their taxes on January 28th got their tax refunds processed and mailed out by February 26th. You know, and that's a mixture of keeping employees employed. You know, if we don't have employees to process those tax refunds because we furloughed them, you know, we're not helping anybody. We're just saying, hey, you know, things are not going well for you, so everybody else across the board should suffer together. No, we need to work to empower each other. We need to help each other whenever we can. And, you know, we need people at Department of Labor to process PUA, to process displaced worker programs, people at GCC, at UOG, people at GDOE. It's a one GovGuam team. And, you know, one thing I will admit, maybe we could have done better with additional duties for people who, you know, their regular 8 to 5 routine in the government was not operating. But, you know, like I said, this playbook was from 2008, 2007. This is something to take into account and give people a greater role to play.
Shelly?
I'm going to defer to Mr. G on this one, and then I'll have a comment after.
Okay, Mr. G, Shelly defers to you on this question. Do you need me to repeat it, or you're good to go?
No comments, actually. I'm sorry.
No comments?
Tax, I can't answer that.
Okay, so Shelly, back to you.
I'm a Republican. We believe in less tax. The original tax increase from, I can't remember which legislature it was.
It was in 2003. It was a tax increase from 4% to 6%.
Right.
It was a 50%
That was supposed
increase.
to be a sunset it.
Yes.
And then it stayed. Now we're looking, last heard on the radio, $78 million surplus. Now, I am a fan of Joe Atta and his administration when he gave the money back to the people. If it means that we give the money back to the people, that would be fantastic. I would like to see that when I pay for my sandwich, I don't have to see that GRT. When I go to a certain department store here, I don't want to see that on my receipt. I like the idea of upfront sales tax and not the GRT, inflated GRT. I think we consider the value of certain agencies, you know, their productivity, their operation, you know, the quality and productivity of their operations. And I think that I would like slash Republican policy to be about streamlining the line agencies, and let's look at their turnout in efficiency. You know, what do we expect from these specific agencies? But again, I go back to, we need to reduce. You know, they say, oh, well, you know, the businesses pay the tax. No, the businesses don't pay the tax. We pay the tax.
Okay. It's very clear distinction between the parties is on this. You wanted to follow up, Chirag? Okay, go ahead.
I have a quick question. You know, when Eddie Calvo raised the taxes, and if he didn't get what he wanted, he shut down, I believe, it was a firehouse and a police station. If we want to cut taxes now, can I know what agencies are now on our cutting block? Which one are we trying to shut down?
So he's asking,
the stipulation.
Chirag is asking about the consequences of cutting the BPT and what the Republican Party would do to balance the budget in that case.
Well, in that case, I believe that they use the proficiency and competency of, you know, top-tier financiers to really examine where's the money coming in and where's it going out. Are we, you know, we talked earlier about education. We see the budget. The budget's very, very generous to the Department of Education, but they never get their funds. You know, every year I sit and I listen to the budgets and I'm thinking, okay, you were committed to get this much money, and every year they come back and say, we didn't get this increment. We didn't get this increment. Now, I can't speak to shutting down fire stations. That's the last thing I want to see. Frankly, I would like to see more presence of firefighters, more presence of GPD. I'm a Second Amendment person now simply because I drive around by myself, and I am concerned about the crime. But we also, we look at the top three: health, education, public safety, and anything outside that, we need to really take an examination. Right now, I think that there's a popular move to reduce the liquid fuel tax. Gratefully, I went to the gas station before it would bumped up to the 20% or 20 cents. I just came back from Los Angeles and I paid almost $6 for a gallon of gas. I am petrified that that's going to happen here. But I think that if we do the public-private relationship, where we ask more questions from the private sector and we don't dismiss, but likewise, we don't dismiss what the government tells us to. If they tell us from a point of experience and responsibility, this is what we really need to make it happen, I think it's very palatable, but I don't see that that's happening just yet or in that manner that the community can respond to.
We're going to have to invite the parties or maybe even the candidates for governor back to discuss solely about the budget of the government of Guam and taxation, because there's obviously two very, you guys are not going to agree on this. Chirag, you wanted to go ahead?
Real quick, when you're calling it fluff in the budget, you got to also keep in mind that fluff was used to erase 16 years of Republican debt of $100 million in deficit that we wiped off. So could the budget have been trimmed? Yes, but is that fiscal responsibility by letting our kids, my kids, your kids, put it on their backs? No. We did what we needed to do. We kept fire stations and police precincts open, and we also cut the budget. And now, for the first time in the history of Guam, as far as anybody can remember, tax refunds are getting paid in 1 year. I mean, if we don't want to pay tax refunds and we want to keep going in debt, and that's what we want to do moving forward, that's fine.
This conversation is giving me flashbacks of when Carlo Branch and I would have these debates on election night, and we would go after each other. Oh, it was wonderful. It was wonderful. We got to get to the next question. And before we cut to a break, and we have our final segment on what happens moving forward. So I believe I asked, who did I ask the last question to first? It was Dr. Berg. So Shelly, what is your party strategy? I'm sorry, Ms. Gibson. What is your party strategy if tourism does not recover for a very, very long time?
Go local.
Can you explain?
I had lunch and dinner over the last couple of days and it was such a treat to look around the restaurants. And these are restaurants that are normally frequented by tourists, and thank you, Department of Defense, for doing your training here, because that's what's keeping lights on in Tumon. But more to that is, on a consistent basis, when the tourists are not here, it's us who have graduations, christenings, weddings. We frequent the hotels. We frequent, the restaurants up and down in Tumon, and then now more in this, we've got restaurants in Agate. We've got McCrouts down in Malolo. I think that we energize that lacking component by applauding and welcoming our local customers.
So expansion of local private enterprise.
Yes.
Okay. All right. Dr. Berg?
Okay. Again, it's not a party issue, but I think exactly is we have, thousands and thousands of military people coming in, and people, if they don't know, you can multiply. If you have 5,000 Marines coming in, it's about 12,000 or something like that. I've seen the number be at least double the number of people that are coming in, and to provide opportunities for those people who are bringing in dollars from outside Guam to spend them here rather than on the internet by restaurants and entertainment and exercise type of facilities. Like a place where you can bring where kids want to go, families want to be. To focus on that, I think is great, and I think that then that when the tourists come, they then join in. But I think honestly, I think that I hope it's not a very, very long time. You can sort of feel. I listened to some Japanese radio, and they're like, they want to travel, right? They want to get out. The Japanese like to travel. The Koreans like to travel. The Taiwanese like to travel. So I think, again, not putting all your eggs in one basket to say we're just going to count on tourism, but we're a tourism-based economy, and I think that's where we're going to have to recover. And we want to make it that the first place the Japanese and Koreans and Taiwanese go is Guam. So I think to focus on making it that isn't a long, long time, while we do exactly what Shelly said, looking at ways of expanding locally. And I think people are doing that. I try to spend locally and not travel. But if there are other things that that Logan would like to add to that, I just say hurry up and work and get GITA, and not GITA rather, but GVB. Get ready to crack get cracking so that as soon as we're ready to, Japan says, yeah, you can now come and promote Guam, that they're ready to go. But Logan would talk about the political aspects of that.
Logan, Dr. Berg is deferring to you. He said that he agreed with Shelly about supporting local enterprise, but he also said that we have to prepare for the return of tourism, and well, he wants to see tourism return sooner than later, and so he's deferring to you about what we do about the economy moving forward, I suppose.
We're at a point in our history where we have an opportunity, right, with the amount of federal aid that's coming in through the American Rescue Plan, to really, really invest in the infrastructure and our people. And if anybody is interested in looking at the administration's plan for investment para Hamzu, just go to governor.guam.gov, scroll to the bottom of the homepage, and you can see what the administration's plans are for an investment in Guam. You can take a look at it, and there's small business support, workforce development, diversification of the economy. There are plans for Silicon Village, transshipment, pharmaceutical manufacturing, alternative resolutions, aquaculture, even plans for a mobile slaughterhouse. We're really, really trying to diversify our economy, and I know that's been talked about a lot. It's a really kind of, I don't know, everyone talks about it for as far back as I can remember. And of course, we want to bolster our tourism industry. There have been a lot of entrepreneurs that have invested a lot of money, and we really, really need to support these people and get those people back to work. But also, we need to diversify and really invest in our local workforce.
So, Ms. Gibson, thank you, Logan. Ms. Gibson, Logan has brought up basically Governor Lou Leon Guerrero's platform on economic development. When might we see a platform from Governor Felix Camacho and Luz?
I would imagine within the next month.
Within the next month. Okay.
There's aggressive meetings being put together. Capitalizing on members of, previous administrations. We have significant contributions from the private sector. Young people who have expressed an interest in coming home, to participate in the medical community, participate. I wanted to point out something that I really strongly advocate is every year we make a commitment to support 1 or 5 public health administration doctorate or master's candidates, not just for the sake of medical, but also for the distribution of healthcare. Because it's not just about Doc's radiology clinic. It's not just about, OBGs or general practitioners. It's women's health, young people's health, senior health. I'm a senior, so.
No, you're not.
Oh,
you're not.
I'm a senior. But this public health administration, drive would be to support insurance. How can we get best quality insurance opportunities, not just to specific pockets, but throughout. We have neonatal issues. We have obesity issues. We've got health. We've got high cancer rates. And I would like to see, more care locally. I know that Doc has done some, pioneering care for some of his patients that I know personally. But at some point, there's got to be a succession. And I believe in, the aggressive advocating for that public administration healthcare delivery system.
Cool. Now we're gonna cut to a short break. Well, not too short. I need to pee, guys. I need to go and use the restroom. So, when we come back, you guys are gonna have an opportunity to campaign for your candidates for Governor Lou Leon Guerrero, or I'm sorry, for the Democratic Party nominee for governor, whoever that might be. And the only declared candidate right now before Logan completes his shooting of me with the daggers in his eyes is Governor Lou Leon Guerrero. And Shelly, Miss Gibson, you got to do some campaigning for former Governor Felix Camacho. When we ask about what your party's candidates will do about the moving forwards and the what ifs when we come back from a commercial break.
Bottom line is we're going to make you a better person. You're going to be healthier and fitter than you were before.
wasn't sure about Troy in the beginning. I could definitely tell that he was focused. His progress from where he was just from the class to where he is now, it's amazing.
Drop.
One of the things I'm proud of Johnny is the fact that I know she didn't want to do it in the beginning.
I never thought about it.
The support that she gives everybody is genuine and honest, and I love it.
And I did the best out of our group.
I definitely could tell that Danielle was shy. She was intimidated the first several sessions. In the conversations that we did have, it stemmed around her change, her wanting more for herself and wanting more for her children. With Eric, where he was the first week to where he is now, it's like two totally different people. He could be the strongest guy on Guam if he wanted to. I'm proud of the whole entire team.
And Q, thank you. Welcome back. And we have our final 3 questions. And this is the campaigning part of this whole thing. Dr. Berg, we'll start with you. Tell us why your respective party's candidate for governor would be better suited if the COVID-19 pandemic continues or worsens. And let's I guess make this more clear. Tell us why Governor Lulian Guerrero will be the better suited candidate against Governor Felix Camacho if the COVID-19 pandemic continues or worsens.
Okay, I'll start and then defer.
Sure.
Because I think my experience has been that when I was put in as the Physician Advisory Group chair and then was meeting with the governor on a much more regular basis, to see somebody who listens, has a healthcare background, knows how to reverse policy when it doesn't work, and to follow science that's available. That's why I stayed in. I initially didn't want to do. I declined the position 2 or 3 times before the governor met with me and said, I'm not going to tell you what to do. I just need to be able to listen to you and I would value your input or something of that nature. And I sort of said, well, let me try, and saw that she does listen. She listens, she has a healthcare background, and she's able to admit when the decision doesn't seem to be helping. Those are critical things for someone to lead you through a pandemic and any healthcare emergency crisis. So I've been impressed with the way she's handled it. But in terms of how that's different from a political standpoint from an opponent, that's a political question. So I'll defer to whomever the Democratic Party would like to have speak. Either Logan or Chirag seem to be available.
Okay, you guys choose Chirag or Logan. Which one of you? Dr. Berg is deferring for you to compliment his answer. Go ahead, Logan.
Well, I think I would be the better person to stump for my
Sure.
candidate. Lulian Guerrero. Well, actually, can you just repeat the question just so I
Sure.
make sure that I...
Tell us why your respective party's candidate for governor would be better suited if the COVID-19 pandemic continues or worsens.
Okay, so Lulian Guerrero has proven that she will prioritize the health and safety of our population, right? And she's also proven that she's able to balance the economy. And she's not, how do I put this? She's shown that she's amenable, she listens, but at the end of the day, it's about preserving the life and the safety of our people. And that should be paramount. And if there was any argument against that means that you would prioritize something over the health and safety of our people, right? And you can see that in Republican policy. Maybe that's not so fair of me to say, across the United States because they have much different circumstances than us. But for us here on Guam, with the healthcare system and infrastructure being what it was paramount. So we had to take a 2-year pause in the administration, really deal with the COVID-19 pandemic. And I say that we have really done an exceptional job given the circumstances that we've had. And if you look at the Department of Revenue and Taxation, they're working better and faster, and all the while managing federal programs. The Department of Labor set up an unemployment program in 6 weeks in what would usually take 6 months. Nurse pay is up, law enforcement pay is up. So that's an investment in our public safety. We're also investing in more sustainable things. And I think it's worth noting that Republicans want to cut taxes for the rich. That's not really an investment in the working class. It's trickle-down economics, and for the past 30 years, that's been shown not to work. They've floated bonds, put us into debt, and this administration has they've reduced the structural deficit, $100 million in a pandemic. I mean, I think that speaks for itself. And, wages have been kept down, and the price of everything continues to go up. So I think
Logan, we're gonna get to the economic recovery portion of that in the next question. You want to save your comments for that portion, okay? Is there anything else that you wanted to say about the?
No, I'll cut it there.
Okay, all right. Ms. Gibson.
I'm gonna give to G the opportunity, and then I'm gonna.
Okay, G. Shelly is deferring to you, and then she's gonna go after you. And the question is, tell us why. Well, in this case, Governor Felix Camacho would be better suited as the governor of Guam if the COVID-19 pandemic continues or worsens.
I'm not very familiar with the governor that's running. I'm very sorry.
Well, against Governor Lulian Guerrero, I suppose.
Okay, I'm sorry, but I'm going to take the opposite side and say I believe that the pandemic has been very mishandled by the current administration.
Okay.
Sadly, in a situation like this, like we had discussed the first hour, we believe that we should have come together, just like any other typhoon or any other issue. What we did in the last few months, unfortunately, is our governor came out and created an outcast group, which I never expected. I escaped communist Russia over 30 years ago, and what we experienced there, people are still writing books on. For our governor to have created an outcast group and come out and say words like, this is a pandemic of the unvaccinated, are hurtful words, very discriminatory, very aggressive. And it's to this day, there are many, many locals that have been offended, hurt, shamed. Basically, those words, believe it or not, they reinvited days of segregation into our island, reintroduced discrimination and shaming. Workplace harassment started to take place. I am, call it a victim or not, of workplace harassment based on a medical, religious, or personal choice for, a medical procedure. So for a governor to come out and say those kinds of words, my question would be is she willing, or is the Democratic Party willing to come out and apologize for those hurtful words? Because like I said, it absolutely caused and introduced days of segregation where people were being kicked out of, here we were talking about tourism earlier, people are being kicked out of restaurants and hotels based on a religious or medical choice, okay? And we've already seen that the vaccine has not done what it was promised to do over 12, 13 months ago, which is what we all were supposed to do. It didn't fulfill all the promises. That's why. So again, there are a lot of folks that have been very, very hurt, shamed, discouraged, lost work. So that's all. That's my question. I cannot believe that in these days, we have a governor in position that reintroduced workplace harassment and legalized it, discrimination, segregation, and shaming. I've said those words a few times. I'm not kidding you. The people I've met in the last few months are very hurt, very disappointed, and just shocked that this is happening today. So I'm not necessarily speaking for, but I'm definitely taking the opposite stance on what our governor has done in the Democratic Party. Unnecessary roughness.
Thank you, Mr. G. Ms. Gibson, G has explained why he does not support Governor Lulian Guerrero, but the question more is why should people support Governor Felix Camacho? So do you want to give the pro on him on if the pandemic were to worsen or to continue, why would he be the better choice over Governor Lulian Guerrero?
Well, I'm going to speak from just a personal point of view. I don't speak on behalf of any of the candidates, be they senatorial, congressional, gubernatorial. But I will say this. I think that we owe a big thanks to Donald Trump for those vaccines that have been, enforced, effected, distributed, jabbed, whatever word they want to say. Truly, if it wasn't for Trump's aggressive and forceful endorsement, advocacy, and financing, we might not be where we at with the vaccines. Speaking to experience with Governor Camacho, I don't think he would call me a vector. I don't know if you remember, they said, you're not the victim, you're the vector. That was kind of harsh.
You're talking about when the governor said.
Yeah.
Okay.
And I'm sure she didn't develop that message by herself. So, I'm going to give that. But, there's questionable hiring. Now, that runs rampant in whoever's administration, be it, Governor Gutierrez, be it Eddie Calvo, be it Felix Camacho, Uncle Ricky. That's typical, but I think that, they took a shot at, Governor Camacho, and I'm going to say some of them are impractical and unnecessary hirings at this pandemic level. Questionable procurement. Now I'm getting notes, right? Questionable procurement process, despite the law saying, that they could bypass procurement, the 3 quotes and all that. Then, there's also the impression of preferential contracts. Again, I go to, it's not unusual, but I think to speak to Governor Camacho's experience and this new season that he brings as an offering to the people of Guam, he comes from a very different place. As he said, he didn't want to just stand by the sidelines. He saw the opportunity to give back. He's been gone 12 years, 16 years?
12 years, I think.
Yeah. So that's a long time for learning, self-reflection, and planning. I can't speak to what his plans are, as they're still in the mix stage. I expect that within the next 30 days, we're going to have the gel and solid, that will be presented with a lot of collaboration, public, private, and speaking to Governor Camacho's experience. He was very successful with federal funding, and knowing my collaborations in Washington, D.C., I can speak to he still has significant relationships on the federal level. That's something to look forward to.
Okay. Ms. Gibson, tell us why your respective parties, tell us why Governor Felix Camacho would be better suited over Governor Lulian Guerrero if the COVID-19 pandemic subsides and Guam goes into a period of economic recovery.
I think, I just said, Governor Camacho's experience, he's got confidence. I think that one of the things that I observe at just the announcement, his level of compassion, and this is not to say that Governor Lulian Guerrero lacks compassion, but I think that knowing the things that he's been doing over the course of the time that he's been out of office, doing his, outreach, feeding homeless, and he doesn't do. Nobody knew this until he, I did help him on a couple of cases, but sometimes when you don't seek the public eye, that's when you become more effective. When you don't have to say, I did it. I'm impressed by that. I think too that he has a level of sincerity, and again, this is not a criticism of Governor Leon Guerrero. I just think that coming from Republican issues, pro-life, Second Amendment, smaller government, less taxation, I think that following those precepts in our Republican policy and philosophy, I think it's a golden opportunity that we have to take advantage of him grabbing the staff and saying, come with me.
Okay. Dr. Berg?
Okay, so with regard to, again, coming out of the pandemic and which party, I'll leave that to political people. But I want to just say something that Mr. G has said, and I think, I think there's some place where you can draw the line when you're working in politics, because I'm not a politician, and I've been, if you will, dragged into this. I suppose I wasn't kicking and screaming because I felt I could do something, but I think when you start thinking that attacking the human being, the healthcare provider, and the mother and husband, and wife, etc., that the governor also is as a human being, and working with her now very closely over the past bunch of months, this is not somebody who wanted to create a divided community, not at all. And to take little things out of context, I could easily say, first of all, I could say that the taking the part of saying this is a pandemic of the unvaccinated, that's taking something out of context that I know she didn't mean in the sense that it's the unvaccinated that are causing it. It was saying that the unvaccinated people were overwhelmingly those who were filling our hospitals and dying. And it was a compassionate thing, not a divided thing. It was a way of saying, if you can get vaccinated, you're far less likely to die.
So then again, would you think that the governor just needed to do a much better job than of communicating that?
But, I think we, perhaps all politicians can, and if you latch on to some use of language that can be spun to make someone look horrible, that she was trying to blame people. The vector component of it, again, this I think is sort of a medical term, that it was a vector is someone who has a virus and is spreading it, but if you take it out of context, it's so easy that, oh boy, that wasn't a good choice of words. But to condemn her as a human being, I think is terrible. That's not what she was trying to do in terms of splitting the community or whatever. And part of bringing me on was to say, how do we help bring the community together in an approach of how to fight this pandemic? But I just don't like that attack on her as a human being, because that is not who she is, that she wanted to divide things. I've never appreciated that at all. I felt somebody who was very compassionate for the people who are suffering. She takes it very personally when people are dying and is searching for a way to stop the people from being dead on arrival. There's no condemnation of those individuals who are coming in and not being vaccinated. I just found that to be not good. And the other thing is to say that all the promises of the pandemic, of the vaccinations didn't pan out. I'd say, first of all, sure, 1,000%. Trump did an amazing thing in getting those vaccines. It's almost like a movie where you watch a movie and you say, oh, and they came up magically they worked over the weekend and developed a vaccine or an antidote. And you think, as a scientist, you say, those take years and thousands of people and bazillions of dollars, but it happened very rapidly. So the administration did it, but the promise of those vaccines was to reduce the number of people who were dying. And just ask our fellow Indians, that is people from India, and say how many millions, I don't know, millions, but at least hundreds of thousands of people were dying because they couldn't get the vaccines into people. So if we could have given those vaccines away and said we won't take them because they're not going to fulfill all the promises, I'd say that is not an accurate description. They saved so many lives. Were they, the God's gift to all of medicine? No, but they were extremely effective at reducing the number of people who died. Do we think that every single person should have been forced to do it? No, and nobody has. But as we thought that people who carried it were vectors, that's a medical term. It's not a discriminatory or condemnatory term. It's a medical term, somebody who is spreading it, right? That when we thought that was a situation we needed to slow that down, part of getting vaccinated was if you could stop the number of people who were spreading it. We even had evidence at that time that if you were vaccinated, you spread it less. You could get it, but you would spread it less. That was science at the moment. Right?
Did it change?
It changed. Now we know that people who are vaccinated with this variety, with the Omicron, nope, doesn't seem to make a difference. If you get it, you spread it just as much whether you're vaccinated. The big difference is if you get boosted, you're far less likely to die. Right? That's why we've been encouraging all of the people at risk to get boosted. But it's a completely unfair and inaccurate scientific statement to condemn the vaccines and say they didn't reach all the promises. They never do. People who get a flu vaccine can still get the flu, but they usually get less of it. And those words, taking them out of context, to hear them, it sounds like painting a picture of an evil person. And that's, I think, you have to be careful. And I think part of what I love about Guam is that, we may disagree on things a great deal, but we don't tend to find ways. We find ways to be more together than we are divided, and that's, I with all due respect to the fact, I wore a uniform for 13 years, so in the Army, so I would die to defend the country. But the continental U.S. is more divided than we are. We disagree on things, but we come together. So I don't think it's quite right, and I'd ask both parties going into this not to attack people as human beings. I don't think that Governor Camacho has an evil bone in his body to do these things, but certainly Governor Lou Leon Guerrero absolutely is wrong to condemn her and say she was trying to divide things or split people. I don't think she meant to do that.
I do want to, this will be my first time interjecting in the discussion, and it's only because what you're saying is actually news to me. I have never heard anyone from the administration actually explain what the governor meant when she said those two things, the vector and the virus thing. I just heard that she said that, and I myself thought, well, it's pretty harsh, Governor. And what was that other thing that we were saying? She
the
said
vector, and they said that it's
the pandemic of the unvaccinated.
Yeah.
Even I thought, up until just right now when you said what you said, that was the governor condemning people who were not vaccinated. So my question for both of you is, do you think that the people who have been saying this, because I think I've said this myself to other people, I can't believe the governor said that, have meant to, purposely disparage the governor just because they don't like her, or because they just never heard this explanation before?
I hope that it's people misunderstanding the terms when they're taken out of context, right? And that certainly, I think, is more likely than people wanting to portray her as evil, right? Because that's where I'm saying we have to draw the line somewhere, and to get clarity. And you're right that maybe that those of us who heard these words we're thinking that they're misunderstanding the scientific word. But when I heard G, and I'm not condemning him either, because if you take it out of context and you think, how could someone have been so evil as to say those things?
Well, you heard what he said. He said that it was a hurtful thing, and it's coming from a sincere place. I thought it was coming from
and
a
emotion.
place.
I could hear it.
Yeah.
I could hear the emotion in that. I'm saying it's been okay. Let me back up, because maybe you're right about that, Troy. And then this conversation can be helpful and healing. In that when G said that, I think I could sense he's genuinely feeling that.
Yes.
That she was condemning him personally, or Ray, who's been public about that I told him from a personal standpoint, I never would judge a human being for making a decision like that. People have a right to smoke. drive a motorcycle without a helmet. I don't dislike them. And I think the governor, I don't know, that has been, that's so heartfelt what he said, but didn't reflect what she meant. And it was taken out of context. But even if it isn't taken out of context, if one doesn't understand that the vector is, meaning the creature that's spreading it, I don't want to compare us to animals, but it's more often used in animals. When we say, what's the vector? Who's spreading that? And they say, oh, it's a tick on a mouse or something like that. Here, it's the humans that were spreading it. So we are vectors, right? I was a vector. I had COVID, right? So from a medical standpoint, we didn't see any need to correct it because it was just a misunderstanding. And the same thing for the pandemic of the unvaccinated was saying that's where we have to work at. And to a certain extent, it worked. And then we got more than 90% of people. But it wasn't because of a divide and conquer thing. And I hope that maybe that will help G to understand it was not meant to isolate you. Nobody.
Well, it's not just G. I think there are a lot of people who have, until right now, understood what the governor said to mean what G had said, and until right now, I had never heard an explanation for it coming from the administration. Ms. Gibson, have you heard that explanation?
No.
Before?
Can I say something?
Sure.
I know the governor on a family level.
Okay.
I have seen her with her children and her grandchildren. She's a family member. We're related in a long roundabout way. I don't know her to be mean-spirited. I don't know her to be an evil woman. I remember having a conversation prior to her announcement to run, and I was really enthusiastic about, having a lady. We talk about the whole Magahaga thing and all that. I don't come from that place. I was raised by two very strong women, so I can do nothing but applaud. But perhaps her message writers and crafters don't know her on the heart level that I know her of. So please, there's no offense intended in my statement. Perhaps she was just reciting what somebody put in front of her, and that, we are affected by all kinds of external forces. But I do want to say this: I don't know her on that level. So when I heard it, I was offended, and of course I'm sensitive to it because my brother, Ray, is openly defiant on the vaccine, but I do have to commend him. He didn't deviate. And I think it's not just Ray. There are religious groups who refuse to take it. There are people who are constitutionalists who say, absolutely not, you can't force me. But I do want to go back to that. There is no offense intended directed to the governor, by no means. I think that it really goes down to choosing the words carefully. And then, Doc, thank you for explaining that, because when that message came out, and I think I sent you the PDF, there was no explanation of that. And so for me, a layperson, wow, thanks, I appreciate that. But hopefully it's not too late.
I hope not. I mean, I think, as I said, and I think this is all sort of related, right? Is that what I love about living on Guam is that we tend to get along much better than other communities, and that division and what that hurt that G was expressing very clearly is something that I hope we can address and fix and come together, even the day before and the day after the election, remain friends, right? And that's because I think people are running because they want to improve the island. I'm absolutely certain that Felix thinks he can do a better job and that'll be better for the economy. I apologize, but former Governor Camacho. So it's not that, but and I said I'm not a political person per se, but I just don't want to, I think maybe something triggered me in seeing, wow, people are really feeling horrible about those isolated words because they sound so evil taken out of context, but they have an explanation. So if I can serve that purpose to help heal that.
Maybe it's good, Doc, that they got a healer. They invited a healer to participate in this conversation.
Well, we are past our 2-hour mark. We have been talking for quite a bit of time. There was one more question left, but you know what? we're going to save it. We're going to invite the parties back to discuss a little bit more those questions regarding taxation and the budget. And we'll invite the parties back to talk about social ills outside the context of the COVID-19 pandemic. And as we move in to more election year issues and the standard issues that there are, maybe we'll be inviting Governor Felix Camacho and Governor Lou Leon Guerrero to our studios to duke it out in a discussion that hopefully is as cordial as tonight's discussion was. We learned quite a bit about the parties tonight, and one among them is that there are actually quite a few more things that you guys agree on than you disagree on. We learned that there is big disagreement on the handling of the economy and tax policy moving forward, which is a pretty big deal. And we also learned that we could do a lot better communicating what is going on in the government of Guam to the people of Guam, especially to those who have really felt like they were on the sidelines of public policy over the past couple of years. And Doc, is this something, as the chairman of the Physicians Advisory Group, you're willing to take back to the PAG and to the governor and have a discussion with her on it?
Definitely. I mean, this is a learning process, and even for me, right? So because I'm in front of a microphone far more often than I ever anticipated, and so even myself in communicating, tonight I've learned something about how people feel that I think is worth correcting, so they don't feel attacked, because it was never meant to be that way. So yes, 100%, and I want to thank you for having this forum.
Yeah, no problem. Ms. Gibson, is it something you're willing to go back to the chairman of your party and Governor Felix Camacho and say, you know what, maybe we need to engage in further dialogue with the Democrats, because there seems to be things that we actually agree on.
Yeah, and I do want to thank you, Doc.
Thank you.
And and I had made it very clear. I felt that it was lopsided putting me with a doctor.
I have to tell you, so I've been under extraordinary stress that both political parties have put me under, because on the one side, the Democrats were saying, are you going to attack Berg, because Shelly's your cousin? And then I got the Republicans saying, they brought Berg. He's a doctor. And I thought, no, come on, guys. We can make this work. And of course, my reputation sucks in this regard. And so I'm glad.
We did okay.
I think so.
I thought you guys did great. And,
but I'll give you credit by saying make it a conversation. Right?
Yeah.
It wasn't a debate. It's a conversation. And I hope that we together help the community maybe in an approach to how to handle this election and not talk about real policy issues rather than personalities.
I think that moving forward, we really got to get past the hostility. I think it's an opportunity for the Republicans to speak from a different voice, and I liken it to. I keep catching myself. Governor Camacho's prayerful nature, and I think we can only go forward from here. And I think it's been, thanks, Troy.
Yeah, no problem. Thank you guys for agreeing to be part of this.
Good opportunity to clarify, and I think that everybody just wants to be clear.
Yes, and people want the truth from both of you, and thank you so much for bringing your truth tonight. This has been an exciting evening. We'll call you guys, we'll call your parties back for further discussions. But and I encourage you to read the comments. There are people who have legitimate concerns and questions. Your parties might want to respond to those questions that they have, the criticisms that they may have, the support that they may have given you. And so thank you so much, both of you. For Kandit News, I'm Troy Torres signing off. Good night.
The Jones Act is a 1920 law justified on national security grounds as a means to bolster the U.S. maritime industry. It restricts domestic shipping to vessels that are U.S. built, U.S. owned, U.S. flagged, and U.S. crewed. However, this law boosts cost by banning foreigners from competing and forcing Americans to purchase ships that are up to 8 times more expensive than those built in other countries. The result is higher transportation costs. Shipping oil from Texas to the Northeast, for example, costs 3 times more than importing oil from Africa. Ultimately, consumers foot the bill. In addition, higher shipping costs push freight from ships onto other sources of transportation, such as trucks, which means more traffic and pollution. Meanwhile, this blatant protectionism has failed to benefit builders of ships in the U.S., whose production is less than 1% of those in China and South Korea. Domestic builders have seen over 300 shipyards close since the early 1980s. Jones Act defenders claim the law ensures adequate U.S. ships during times of war, but during U.S. deployments during Operations Desert Shield and Desert Storm, foreign-flagged commercial ships carried twice as much equipment as their U.S. counterparts. In fact, the U.S. was so desperate for shipping that it twice requested the use of a cargo ship from Moscow. Both requests were denied. So the Jones Act has failed to achieve its shipbuilding and national security goals while driving up costs for consumers. It's time for this outdated, costly, and ineffective law to be repealed. It's time to end the Jones Act.
Have you or a loved one been injured through medical negligence or substandard medical care? Are you angry? File complaints through the Guam Board of Medical Examiners to make physicians accountable. It's time that we stand up to protect our families and the people of Guam. The complaint form can be found at GBME's website, www.guammedical.org. Have questions or want the form emailed to you? Contact us at asher@asherdeanlubofsky.com or our Facebook page, www.facebook.com/bunzoasher. We do not provide legal or other professional info or services. We do this to improve medical care on Guam through medical accountability equity. Justice for those injured or killed through medical negligence on Guam.